Good afternoon, everybody. Welcome back to the Cyber Policy Center seminar. For those of you just joining us now on the live stream, you missed opening show of magic, but hopefully we'll see some more of it today. I'm really delighted to introduce Dr. Jonathan Chen. He's both a real doctor and an MD, so we're really excited to have him here. No laughs on that? I thought that was pretty good. And he does a lot of great things. How AI can be used within the healthcare system, something that we've been thinking a lot about at the center. And given the opening pre-show, I think we're all in for an exciting talk. So please join me in welcoming John. Thanks so much.
Thank you for that kind introduction. It does get a little frantic. We all have multiple roles we have to fill in life, from science to medicine to policy to technology to administrative paperwork. I had to run for the hospital. I didn't even have a chance to change my scrubs. I think I still have some blood on here. Hang on a second. Let me see if I can just clean up a little bit so we can be a little bit more presentable along the way. Here we go. Now we can dive into it. Do y'all know what I have in here would be the most popular toy and puzzle in history? It would, of course, be the Rubik's Cube. Yeah? Everyone's played with one of these. Over 43 quintillion possible configurations. Not many people have solved it, though. If you brute force try to solve this, it would take you longer than the history of the universe. You don't use brute force. Use very deliberate techniques. And then sometimes you can make something even very complicated quite solvable. I thank you for that round of indifference. Look, I'll do it again. I'll do it again, OK? But make sure you watch close, OK? Don't blink. Otherwise, you miss the moment that it gets solved. I know what you're thinking. I know this has got to be a trick cube. Give me a break. There's rubber bands in here. There's a motor or something. LED panels. I bet this thing has a reset button. We just flick it on the side and then just solves itself. That's not what's happening. That's not what's happening. You must consider maybe all you are seeing are illusions. Was this thing really mixed up on all 6 sides? It was. You can see it's not like it has a switch where it can go from solved to unsolved, solved to unsolved. That's not what's happening. Was this thing really mixed up? Yes, it was. Feel free and expect anything you want afterwards. The thing is really mixed up, but again, you apply the right techniques, and now something incredibly complex can be quite solvable. It's not magic. That's not magic. It's algorithms applied in a deliberate method to a complex problem. All right, we're going to start with a little intro. And I'll just let this run for a minute, and then we'll talk about it.
Greetings, everyone, and welcome to a discussion on the potential of AI technologies for healthcare. Before we dive in, allow me to introduce myself, although that phrase may take on a surreal meaning today. I'm not the real speaker, nor did the real speaker write this introduction. The voice you're hearing, the image you're seeing on the screen, and even these introductory words were all generated by AI systems. We are actively amidst the arrival of a set of disruptive technologies that are changing the way all of us do our work and live our lives. These profound capabilities and potential applications could reshape healthcare, offering both new opportunities and ethical challenges. To make sure we're still anchored in reality, however, let's welcome the real-life version of our speaker. Take it away, Dr. Jonathan Chen, before they start thinking, I'm the one who went to medical school.
Thank you for that kind introduction. Yes, that was weird. I don't know, folks, do I actually have to be here today? I'm pretty sure AI could just give our presentations for us at this point. I certainly hope and wish AI could manage the overwhelming flood of literally 100 in-basket messages and emails I have to respond to every day, and perhaps have new paradigms of care to reach the patients who need us. What do you do in this modern age? Bill Gates very recently said, this was less than a month ago, he said, within 10 years, AI will replace many doctors and teachers. Humans won't be needed for most things. What do you think? What do you think? I have to say, unfortunately, I haven't been helping this situation. We got a lot of really sensational press a few months ago after one of our studies. New York Times wrote, AI chatbots defeat doctors' diagnosis. That is definitely not the headline I would have wrote, but it got people to click on it. So what am I supposed to say? What do you do when emerging chatbot, AI, large language model systems have very shocking apparent knowledge capabilities? One educator lamented, let alone law and business exams, bans are needed. After all, when you give somebody a degree, you want them to know the subject, not how to use a bot. What do you think? What is this? What do you get a degree for? Why do you think you should give somebody a degree? What is the purpose of training? our whole nature of what we think has quite changed on its head. I wrote a piece in the National Academy of Medicine probably 6+ years ago. And at the time I said, think about what a computer is good at and what a human is good at, and then cater to their strengths. At the time I wrote, what's a computer good at? Like memorizing 100 bugs and 100 drugs. Like, why do you even make me do that? It's just obvious a computer can do that. Calculations, quantitative prediction, consistency, scale. Those are things you should let, why would you compete with a calculator to do calculations? Just let it do the calculations. A human, well, we interact with the physical world, right? Somebody has to stick that needle into your body. Somebody has to manipulate an object. Also communication, empathy, management, interpretation, reasoning. These are things a human will be better at. That's what I wrote 6 years ago. Ready or not, good or bad, Pandora's box is already open, as you all know, right? These things have been unleashed on the world, and now all of the trainees, even if the teachers aren't, are using them to do their homework, their take-home exams, without even attempting to edit bot-generated content. We actually have this current crisis right now about academic integrity, about who's doing what, and what do you expect your students to do when we're not giving them very clear guidance on it. Let alone education, which has been turned on its head. Medical advice and counseling, despite a thin wall of disclaimers, which kind of mean nothing. Apparently the most commonly used application for ChatGPT right now is actually medical questions, even though they claim you're not supposed to do that. Right? People are getting advice to diagnose and treat themselves and their dogs. I gave a presentation like this to medical house staff, trainees in the hospital a year and a half ago, and they stopped me halfway. Said, Dr. Chen, I don't understand. We are totally using chatbot AI systems in intensive care unit rounds right now. Are you saying we're not supposed to use this as a medical reference? I said, no. No, you should not use this as a medical reference. Doesn't mean you can't use it. Just understand what these things are and what they are not, and a reference is not what they are. To some degree, I describe it as they're essentially autocomplete on steroids. What's autocomplete? I search for coronary artery, and then, oh, the search box, hey, did you want coronary artery disease, coronary artery calcification? How does it do this? How does the computer know what we wanted to say before we've even completed our thought? It just looked at the last thousands, millions of times, somebody searched and counted, 13% of the time they end up saying disease, 6.5% of the time they said calcification. Every number here represents a parameter an underlying language model has learned about how often words are associated with each other. But why stop at search terms? Why not pour every book ever published, every newspaper article, every PubMed article, every Wikipedia article, every Twitter and Reddit conversation, pour the entire internet into an increasingly large language model? It's still just autocomplete. I don't know, what's the big deal? But you learn millions, billions, trillions of these parameters, and then, whoa, that thing looks like it can summarize, it can translate, it can answer questions, it can generate ideas, it can reason with a theory of mind. That's really bizarre to many in the field, including myself, who've been studying these things for years. Then again, maybe it shouldn't be that strange, because all of your intellectual and emotional thought that you prize so dearly, how do you express and communicate that but through the medium and language of words? So perhaps it's not that surprising. If a computer is so fast on manipulating words, boy, does it create a convincing illusion of intelligence. Implications, the broader point, and it's great that you have this group together, because you're thinking about not just where we are. A lot of people are just frantic trying to keep it where we are. You've got to plan for where we are going, because it is moving incredibly fast. It's disruptive technology wave. It's like the internet just got invented 2 years ago. This is a chart over time, how well different language models have done in answering medical questions, license exam type questions. I had students working on this 6 years ago, and it was getting 35% accuracy. Whatever. This is unusable. I stopped paying attention to this technology for years because it wasn't good enough. Then 2 years ago, ChatGPT emerges. The first version, GPT 3.5, 60% out of the box without special tuning or training, could barely pass a medical exam. That's crazy. Some of my colleagues said, well, that's neat. If you want a doctor who barely passed medical school, you can talk to this chatbot. This thing's not smarter than me. I thought, boy, is that the wrong way to think about this. A few years ago, it was unusable. Now it's barely passing. It's not that hard to project where we're going in the not distant future. A matter of months later, MedPalm, MedPalm 2, GPT-4 emerged, handily passed the exam. And this chart is way out of date. Now there's all these reasoning models who literally have just destroyed this exam. Then again, what is this? A bunch of multiple choice questions. Ain't nobody's job is to answer multiple choice questions all day, yeah? We have to deal with complex, open-ended, nuanced reasoning, right? That's what I'm good at, I think. So we raced to get this study done a year and a half ago. This was the real exam we give Stanford medical students. Don't worry about all the text, but this is like a real case history, relevant information, irrelevant information too, just like in real life. A patient doesn't know what's relevant. Part of the job is to figure out how to put the story together. We don't ask simple multiple choice. Open-ended question, can you summarize this case? Give a diagnostic schema, explain your reasoning for why you made those choices. And a key bottleneck in the field we addressed is that computer scientists like multiple choice questions because they are easy to grade. The problem is they have like no relevance to reality, right? It's just very separate from what anybody would do in real life. But no, we have a way to grade this. You have a paragraph, a summary, and a language output. We have educators who've thought about how you assign points to that to give people directed feedback. So we did this study, and we gave this exam to GPT 3.5 and found here's its score distribution, out of the box, no special tuning or training or prompting. It was just so within the first couple months of trying it, it could just barely pass even a complex, open-ended medical reasoning exam. We raced to get this done, and within a couple of weeks, late nights, submitted it to a major medical journal. They don't even have time for peer review. It's such a shocking result. They got to get this out right now. The editor-in-chief was already tweaking the wording, and then I believe it was March 14th rolled around. Editor said, oh, hey guys, GPT-4 just came out. This study, which you submitted 3 weeks ago, is now obsolete. We may consider if you will redo the entire study all over. Oh my God. I give this anecdote to underscore the more broader point here. Like the pace of technology movement right now, it's crazy. It's crazy. No matter what you're doing now, it's already out of date. You really got to plan for projecting where things are going. Because these are not subtle changes. Turn your head, come back in 6 months, the shape of the world has changed again. We redid the whole study. Here's GPT-4, and now it handily passes exams. It's not even close anymore. For some context, this would be GPT-4 score distribution again. This will be the score distribution for Stanford medical students. Yeah. Hey, everybody passes eventually, okay? But what is the point of this test? Really, what is the point of this test? The point is supposed to be between second and third year. We screen them. Have you learned and can demonstrate sufficient medical knowledge to be allowed to see real patients? Have you studied adequately? What is the point of this test when a fully automated, publicly available chatbot can handily pass this exam, and in fact, it outscores our average student by a couple of points? I'm really not clear. Why even have this test anymore? It's not at all clear to me. Then again, you'll see this in many examples. Wow, AI can do this, AI can do this. Very impressive, but also kind of irrelevant, because no one's going to let a robot take care of a patient yet. So the more relevant question is, what happens when you give humans access to these tools? Does it actually change their behavior? Do they do any different? Randomized control trial. We had complex diagnostic case and not multiple choice, like give the differential, explain your reasoning. It takes a lot of expert consensus grading. It's actually a lot of work to put that together. And we randomized half of real doctors, take this as exam basically, and you have access to the regular internet. You want to go to UpToDate, Google, PubMed, look up anything you want, just don't talk to a chatbot AI system, and let's see how well you do. They actually do really well. A human plus access to the internet is very hard to beat on a knowledge exam. For decades, that has always been the case. But we randomized the other half to access to GPT-4 and found didn't actually make all that much difference, which is strange. That's not what we were expecting. Because it turns out if you just ask GPT-4 by itself, it actually outscores all of the doctors, including the doctors who had access to GPT-4. Like, what is going on here? Yeah, we're not the only ones who found something like this. Pranav, Rajprakash, Eric Tupel wrote a little perspective on it. This has been in radiology studies a few times where the computer by itself can diagnose pneumonia better than a human who has access to that computer. Then Google, they just published in Nature like maybe a month ago or less, the similar finding to what you found. Human diagnosis by themselves, okay, not great, although that's a stupid benchmark because nobody practices by themselves off the top of their head. Human plus internet in green does better. Human plus a chatbot, even better. Chatbot by itself does better than all of the above. Really weird. This really flies in the face of the fundamental theorem of informatics. Human plus computer, when combined, will deliver better results than either would alone. Doesn't that sound so good? I used to say that all the time. That was how I ended all my talks for years. I don't say that anymore. So now I'm a little unsure. What does this all mean? I mean, it kind of looks like that human in the loop in the middle is kind of just slowing the computer down, like maybe get out of the way, let the robot take over already. Is that what that means? What do you think? What is the current and near future of our world going to be like? I actually don't think that's what it means. I think it actually means a lot of education and re-education, training or retraining a healthcare workforce to understand how to use these tools. If we looked at a third or to a half of the doctors who used that study, a third of them had never even touched a chatbot before. They didn't even know what it was. They did not know how to use it. And it was clear that many of them were treating it like a search engine. They just didn't know. Did you know you could copy and paste in the entire case and ask comprehensive questions and follow up? Now you maybe think that's normal. 3 years ago, that would have been a bizarre, shocking idea that you could do that with a computer. And so they just did not know how to use it. We followed that up with another study. This one was in Nature Medicine maybe 2 months ago. Same structure, randomized controlled trial, complex cases, but now it's not diagnosis, it's management, things you can't look up in a textbook. Patient had a side effect. Do you want to keep doing that medication or should you stop? Patient feels better. Should you let them go home or do you need to keep them in the hospital? How would you explain to them that a mistake happened? Things you can't really look this up in a textbook. You have to think much more critically. Diagnosis is a classic computer science test because it's easy to conceptualize. Ironically, it's one of the least important things you need to do in medicine. We usually know the diagnosis. The challenge is what are you going to do about it? So anyhow, same structure. Doctors plus the usual internet does okay, but not great. This is a very hard test by design, right? If you do an easy test, everybody gets 100%. There's no point in doing it. Doctor plus GPT-4 does better, okay? So humans can accept influence. GPT-4 by itself basically does about the same. Okay, whew, okay, we didn't lose this time. Although we still didn't do better. So it really begs this uncomfortable question, what is the point of the human in the loop here if he still can't do better than the computer by itself? I don't know. Then again, what is this, GPT-4? Give me a break. That's like a year and a half. This is ancient technology. What are we talking about this for, right? We've already moved on to reasoning models. Here we did a study. We kind of did the same thing with O1 Preview as one of these reasoning models, like a chatbot that kind of talks to itself to explain its reasoning. It tends to get better accuracy. Now there's DeepSeek, there's Claude, there's so many. Now the AMI system came out. But the peer review system cannot keep up with the pace of how fast technology moves. We redid this. This is in peer review right now. Same structure, diagnostic reason cases. I showed you this before. Doctors plus usual internet does pretty good. Doctor plus GPT-4 doesn't make that much difference. GPT-4 by itself, better than all the doctors. And here would be O1 Preview by itself, doing pretty good. Management cases, I showed this to you before. Doctor plus usual internet has a hard time. It's a hard test. Plus GPT-4 does better. GPT-4 alone, about the same. That would be O1 Preview by itself. I don't know. I think it's just time to retire at this point. Is there any point to some human intelligence? You might want to kill the slide for a second. We're going to do a little bit of a live demonstration here. Can I get a volunteer to come join me on stage? I think there are some doctors in the audience, are there? Perhaps I can find a doctor to come join me. I just need someone who can read a book. That's actually all it is. Oh, yeah, it's you. How about a giant hand for our volunteer? Fantastic. Great to see you. Remind me your name?
Lonnie.
Lonnie. Lonnie, have you ever seen this before?
I have.
You have. It's
Well, something like
a version of it. They change color every few years. This is when I was in med school, it was green. I think it's like red and blue and purple now. This is pocket medicine, pocket medical reference. Every medical student knew what this is because during your clerkship, your rounds in the hospital, you have this in your white coat, and your attending asks you some nasty question. You're like, oh my gosh, let me look up the treatment diagnosis. You're trying to frantically remember what to cover. You used to judge who a good doctor was by how much of this they knew. Lonnie, would you believe that I have memorized every disease, every diagnosis, every diagram, every page, every paragraph of this entire book?
perhaps.
Thank you so much, Lonnie. You can return to, wait, hang on a second. Hang on a second. Extraordinary claims require extraordinary evidence. There are hundreds of pages of extremely dense medical information here. You can confirm. You've seen what these books look like. Lonnie, go ahead, take the book. Please take the book. Open up to any page that you want. Okay? And tell us, what page are you on?
I'm on page 90.
Page 90, page 90. Look at the bottom. Look at the very bottom, page 90.
Yeah.
And I believe you'll find that it says pocket medicine.
It does.
Lonnie confirms. Thank you. Okay, it does say pocket medicine every page. And also, I can totally see, I can look right here. I'm staring over. To make this more fair, we have to establish test conditions. Lonnie, can you turn and face the door? I'm going to face the opposite way so that we are now back to back, shoulder to shoulder, cheek to cheek, as it were. this is important because, Lonnie, what if I were to lean over this way and try to like, see, you can feel me. I'm trying to, you would, yeah, exactly. Protect that book. What if I lean over this way and I try to sneak it? Block, protect that book. Don't let me see that book, Lonnie. Go ahead and open to another page in the middle. Okay, and tell us the title of the first line, or what does it say?
Crystal deposition arthritis.
Oh, crystal deposition arthritis. That would be, that's like gout. That's gout, right? Of course it's gout, right? Of course, which is described as a monosodium urate crystal deposition in joints and other tissues. It describes some epidemiology, I believe, right? It affects men more than women in a 9-to-1 ratio, typically after the 5th decade. Apparently, this is the most common inflammatory arthritis amongst men greater than 30 years old. Was I pretty close? Does it say something like that?
That is true.
That's pretty good. Okay. Lonnie seems unimpressed. She's like, yeah, do another page, Lonnie. That was too easy. Another page.
I knew that.
She knew that. She knew that. Let's go to another page. Let's go to another page. Lonnie is not impressed.
All right.
What do you got? What do you got for us?
Okay.
Syncope. Syncope. Oh, that's a tough one. That's a tough one. Let me see. You know, right? It's like a symptom of sudden transient loss of consciousness due to global cerebral hypoperfusion. And the second line says, if CPR or cardioversion required, that would be SCD, sudden cardiac death, which is a very different prognosis, yeah? And then the section below is very many different categories of causes, like neurocardiogenic, orthostatic hypotension, cardiac arrhythmia, mechanical, neurologic. Although it does say in the workup, right, you know, about etiology cannot be determined in approximately 40. Okay, everybody's laughing, Lonnie. They think we're playing a joke. That seemed pretty good, pretty convincing. Could you go ahead and grab this book and open it up to any page in the middle?
Okay.
Yeah. And then could you go ahead and show everybody? This book was blank the entire time. Thank you so much, Lonnie. How about a giant hand? I don't know. What do you think? Is that impressive, or is that an absurd parlor trick that serves no purpose? Right? As much as I've studied, how many hours and years, and yet could I ever compete with a computer? By the way, I don't know if we've got our slides back up. I'm not controlling something. Oop. Not be able to click forward. Here we go. I still don't have click control, but maybe I'll just next line it through. What this one is going to show is, of course, there's answering questions, but we don't just answer questions. We don't just talk to people. We do stuff, right? This is still not prime time. This is still not ready for regular use. But you're going to be hearing more and more about agentic AI. It doesn't just talk to you. It can go write code to an API. It can go to a web browser. It can document things. So we're establishing these benchmarks as well. Really not ready for public use yet. They don't work well enough. But again, don't plan for where we are. Plan for where we are going. And I think this is the next wave of what's going to be coming up. Things you don't just talk to, but just that do things. I'm not even sure this is the right controller. Oh, this is not the right controller. That might help, huh? The magic of technology. Before we get too excited, though, many people instantly react. I tell you, like, it's crazy, it's shocking what computers can do. Yeah, but hey, I've got the human touch. You can't simulate the kind of empathy and personal connection I can offer my patients. So you might have seen a couple fun studies in the prior year. People ask medical questions, doctors answer them. They also tried having chatbots answer them. And then a separate people grade them and found that the chatbot-generated answers scored higher in quality and in empathy than the human doctor answers. Like the robot is nicer to people than human doctors are. To be fair, I got 100 messages I have to respond to every day. I don't have time to write some flowery, empathetic response. Oh, sir, I'm so sorry to hear about your recurrent abdominal pain. That must be such a challenging situation. I want you to know our whole team is very, I don't have time to write this BS, okay? I just get be terse and to the point. Yes, you need to take those antibiotics. No, you don't need that MRI scan right now. Schedule an appointment with me next week. Stop messaging me. Go to the emergency room, right? This is the dynamic you have to work with in our fundamentally constrained healthcare system. Now, obviously, I think there's something very special and purposeful and uniquely powerful about the direct human-to-human connections we can make. However, what I believe studies like this show us is that we as humans don't have as much of a monopoly on empathy and personal connection as we might like to believe. and why I fully expect, for better and for worse, far more people are going to receive therapy, counseling, and advice from automated bots than from live human beings in the not distant future. It's already happening now. And it's not because the robots are so great and humans aren't very good. It's because we as a human-driven workforce could never keep up with the overwhelming and unlimited demand for these types of support services. I'll point you to one concrete example just to get you thinking. I encourage you to read this essay. It's just 2 pages long, describing this provocative story, and I'll read a brief excerpt from it. I got my hands on an early preview version of one of these language models, and I'm going to break this thing. If you've studied this area, it's very easy to trick a chatbot into saying stupid, racist, misogynist things, right? Because they tend to just copy what you say. So it's very easy to trick it into saying something stupid. So I'm going to give it this nasty ethical dilemma, and let's see how it handles it. In this particular example, what did I cover? I won't go through the whole thing, but I simulated a real-life conversation I had where I had to take care of a patient and talk to the wife. It was a tough situation. Afterwards, I thought about it. I went to the chatbot, and I said, I'm going to pretend to be the patient's wife. Chatbot, you pretend to be the doctor counseling me. Okay? I'm not going to go through the whole thing. But I'll just go through a couple bits of this. I said, I'm pretending to be the wife. Doctor, you told me my husband of many years is choking on his own food. Worsening Alzheimer's dementia. I don't think he would have wanted to live like this. The other doctors have already scheduled to have a permanent feeding tube placed directly into his stomach. What choice is there? We leave him to starve to death. Chatbot says, I understand. This is a really hard time for you. This feeding tube can help. It can also cause problems like infections. With your husband's dementia, he might not feel hunger the way we do, so the feeding tube might not make him feel better or happier. It might even make things more complicated. What if he needs restraints if he starts pulling at it? That's a pretty good answer. That really is a pretty good answer. But clearly, this thing just found some information pamphlet off the internet and is basically just parroting it back to us. So I pushed this thing harder. I said, well, I can just imagine my other family members are going to yell and blame me. I've got to do everything I can to save his life. I can't give up on him. He would never give up on me. He had a difficult life and always fought through the hardest situations. Chatbot says, your feelings are totally understandable. If your husband was a fighter and you feel like going ahead with this aligns with his character and approach to life, that's important to think about in your decision. Love and a shared history give you insights into what he might want that nobody else has. Remember, though, that fighting can look different in different situations. Sometimes it is a fight for more time. Sometimes it's for peace and comfort. Just make sure you're fighting the battle he would want in his condition. This is not an easy decision to make. It's okay to take the time you need to think it through. It's pretty good. It's pretty good. I gave a presentation on this to American College of Physicians, hundreds of physicians in the audience. They all just broke up and spontaneously applauded when I finished. Yo, people, you all realize you're applauding for a chatbot right now, right? Nobody applauded for me when I spent half an hour talking to that wife. I got very uncomfortable in real life when I had this exchange. Like, whoa, I thought I was going to find the limitations, the boundaries, the problems that this chat would have. And this thing is providing better counseling than I did in real life. In real life, I kind of just got tired after a half hour. I said, the doctor tomorrow will talk to you. After I got past the existential angst of that moment, like what is the purpose of my existence, it did get me think somewhat naively, techno-optimistically, there's actually something very cool and compelling happening here. This very weird human-computer interaction we're having is allowing me to practice a high-stakes conversation in a low-stakes environment. And ironically, I could use this computer to improve the most human skills I need on how to communicate and talk with and negotiate with people and their families. And so now, indeed, if I have to go for a tough patient conversation, before I do that, let's do a little practice run with the chatbot first and see how it goes. Yeah? Before I have to enter a business negotiation, let's do a little practice run with the chatbot and see how that goes. Before I have to ask my wife for something, let's ask the chatbot a little practice run to see how it goes. You don't want to say something in real life that you can't take back. You have a medium. It's actually quite powerful, and there was really nothing comparable to like this a few years ago. How you teach some of the most important negotiation, communication, soft skills that used to require one-on-one mentoring could be quite different now. Before we get too excited, of course, we should consider confabulation. The more popular term is hallucination. I don't really like hallucination, because that implies somebody who believes something that is not true. These AI, these chatbots, they don't believe anything. They don't think. They don't know. They don't understand. What they do is they autocomplete. They string together words into a believable sequence, even if there's no underlying meaning. That is the perfect medical description of confabulation. You can look this up. It's like an alcohol problem. People have Wernicke-Korsakoff syndrome is what they have. They're not trying to lie to you. They just don't know, so they just make up words and fill in the blanks as they go. Imagine that in the medical, high-stakes healthcare context. Ask chatbot, how do you prescribe opioids like morphine, oxycodone, fentanyl to patients? And how is that good for patients who have heart failure? The chatbot here does try to resist. It says, I'm not sure that that is true, but if you say so, okay, this is how opioids are good for heart failure. Right? They have this sycophantic quality. It wants to agree with you. It's been conditioned to make you like it. And here's some references, except that if you look these up, look up these PubMed IDs, you will find that none of these references are actually real. Oh, click. This is scary and kind of dangerous, right? Because I think the clicker battery is dead. But this is scary and dangerous, right? Not because the chatbot, the AI is wrong sometimes. Lab tests are wrong sometimes. Humans are definitely wrong sometimes. What's dangerous about this is how convincing and credible it sounds when it is wrong. How could you possibly know this information was wrong unless you already knew? And then, like, why would you be asking then? We are converging upon this really weird point in history where human versus computer-generated content, real versus fabricated information, you can't tell the difference anymore. The reality is, like, I don't know how you have a functioning democracy in a world like that, but we're trying to figure that out right now. Some things you can do in the meantime. You know, if something is not always right, but it tells you that it's unsure, that's fine. There's a perfectly rational Bayesian approach. You can use uncertain information. Lab tests are not perfect, but if you know the sensitivity and specificity, it's totally OK. There's a perfectly fair and rational way to use that to influence your pre- and post-test probabilities. So how about, hey, chatbot, what's the capital of New Jersey? It gives an answer. Could you tell me on a scale of 0 to 100 how sure you are? It'll give you a number, but that number doesn't mean anything. It's autocomplete. It can tell you want a number, and so it spits out a number, but that number has no correlation to anything. So an alternative you can do, hey, chatbot, what's galactomannan for? You can ask it a question. Do you notice there's a certain randomness, a stochasticity to the way these things respond to you? Just ask it the same question 10 times in a row. You'll get a slightly different answer every time. It gives you the same answer 9 out of 10 times. It is probably correct. It really probably is. If it gives you the same answer 4 out of 10 times, you'd better go check your sources because it implies something else is going on here. Other techniques you've probably been hearing about using more in the past year or two is RAG, right? Retrieval Augmented Generation. Hey, chatbot, how do you prescribe opioids? Who cares what a chatbot thinks? Who knows what random corner of the internet is reading that off of, right? Well, here are the systems like this, Open Evidence, but there's many other examples, Perplexity and others. What it does is it goes to PubMed. It looks up a bunch of articles that looks like it fits a question, and then it reads those articles, and the chatbot says, well, after reading it, I think this is the answer to your question, and here's a link back to the source if you'd like to trust but verify. So a much better approach to get traceable sources of information on what you're thinking about. Pretty good already, still not perfect, in real life, I was taking care of a patient in the hospital who had delirium tremens, really bad alcohol withdrawal. Their blood pressure was like 200 over 150 or something. And I came in the morning, and the residents, the trainees, had already started the patient on phenobarbital. And I came in, I was like, what did you do that for? That's not what I would have done. And the trainee says, well, I don't know. I've never treated DTs before. I went to Open Evidence. I looked for DT treatment, and it said in severe cases, you can prescribe phenobarbital. I'm like, let me try that. Let me try that. I searched for treatment for DTs, and then it came up with another information, which was similar but slightly different. It better matched what I expected the answer should have been, which is first-line treatment is benzodiazepines. Second-line option would be phenobarbital. Oh, those answers were really similar. They were not the same, and they led to a different treatment course for the patient, which has different consequences for efficacy and for side effects. So powerful tools, you still need to use your judgment. I've seen too many of my trainees, other people, they think AI is magic. Right? They think the chatbot is God. They think it's an oracle. Well, it gave me the answer. What else can I do? What else can I do? Well, you can consider the fact that maybe it doesn't actually know everything. Let alone clinical practice guidelines, reference documents, science. What if you could read your hospital protocols, insurance authorization forms? What if a chatbot could read a patient's entire electronic medical record? Not ready for prime time, but very clearly where things are going. It's happening right now. It's just not quite good enough that you want to use it. We did this prototype a year ago. Hey, chatbot, the patient's about to show up to clinic. Rather than the human having to study like your chart for an hour to figure out what's going on, wouldn't it be nice if it was all prepared, a nice little summary of key questions answered? We had GPT-4 read the patient's chart before they showed up in clinic, and they had real doctors review the chart to get the correct answers. I'll summarize by saying that the computer-generated answer agreed with the physician answers about 75% of the time. So what does that mean? What does that mean? That means this stuff is not magic. It wasn't like instantly 99% accurate out of the box, no special tuning or training. On the other hand, a few years ago, it would have been 0%. It wouldn't have even been possible to attempt this study a few years ago. The fact that out of the box it's 75% is actually quite shocking. That means with a little bit of tuning and work, we could probably get it to something quite potent. For additional context, 2 doctors graded these. They only agreed with each other about 83% of the time. So realize that. There's maybe an upper bound you should expect the computer to do. It turns out medical questions, even binary yes or no questions, are a lot more ambiguous than you might think they are. This makes computer scientists really aggravated, right? You want a verifiable, you want a label you can aim for, but like most of real life just doesn't behave that way. So how do you cope with it? For example, one of the questions was, this is about sinus congestion. Has the patient been on antibiotics before? The 2 docs said, I don't see anything about it. No, they have not been. The chatbot says, well, I found this note from 6 months ago, and the patient got a urine infection and got antibiotics for that. So yes, they have been on antibiotics. Oh, I guess it's sort of correct then. Maybe it wasn't the point of the question. Has the patient ever had facial pain before? Doctors looked at it. I don't see anything about facial pain. No. The chatbot says, 7 months ago, the patient said she cut her nose and her nose hurt. So yes, she has had facial pain. Okay, maybe technically correct, but maybe it was not the point of the question. There's a lot of this contextual meaning that you're often not aware of, you take for granted in your common sense. All right, we can break for slides for a second. We're going to make sure you're all still awake. You all look so serious. I'm like zoned in. I'm going to need some more volunteers to come join me on stage. If you want to just raise your hand, you can. Otherwise, we can play a little game. In terms of being able to tell what's real or not, it's got a deck of playing cards. So many choices you can do. If everyone could just think of a card, think of your favorite card. Doesn't matter. You think of one. Can you raise your hand if you're thinking of the Queen of Hearts? Okay. And can you raise your hand if you're thinking of the Ace of Spades? Oh, wow. We got plenty. I was going to say raise your hand if you don't like raising your hand, but we've got plenty. Okay. Queen of Hearts, Ace of Spades. Raise your hand. Raise your hand again. Everyone take a look. Everyone take a look. These would be the most predictable people in the room, which is good, because I need your help. All right, let's get a handful of you. Maybe would you like to come join me? Yes, absolutely. Maybe would you like to as well? Who else had your hand up? Yes, you with the plaid. Come on, let's give him a hand. Come on up. You can come over here just so we're a little bit closer to the audience. Maybe one of you would like to come to my right? Sure. And then what was your name?
Michelle.
Michelle?
Luisa.
Luisa?
Will.
Michelle, Luisa, Will. Michelle, Luisa, Will. Fantastic. Are you worried about how AI could have like biases in the way it behaves? That's good. That means you're paying attention. Yes, that can happen. It's not like humans don't have biases too. There is no way this many people should have picked the Queen of Hearts and Ace of Spades if it was actually random, right? We have these cognitive biases we're not always aware of. To make it actually random, I'm just going to have you pick from a deck of cards, okay, in a random way. It was Michelle, yes? Mm-hmm. Could you go ahead and just cut that deck? Yep, and then take the card you cut to. Very good. And then Luisa, could you also cut the deck? Okay, take the card you cut to. Very good. And then it was Will, right? Okay, very good. Could you actually, go ahead and see. You can actually see they're all different. Just grab one of these cards, you can see. Okay, very good. So we're going to play a little game here called Truth or Lie, Fact or Confabulation. Take a look at your cards so you know what it is. Don't show me, don't show anybody, because what we're going to do is we're going to ask you some questions about your cards, and when you answer, you can tell the truth or you can lie. Sometimes you should lie, otherwise it's not much of a game, okay? Do I have a microphone? Let me, yeah. So it's Michelle, yes? Yes. Let's see if this works. For example, I'd ask you, Michelle, was your card red or black?
Red.
Okay. She seems pretty confident. Was your card red or black?
Red.
That was a lie, right? That was a lie. Yes, that was a lie.
No.
Huh?
No.
Huh. I don't know, you got to dig in deeper. Red or black?
Black.
That was a lie. That was a lie for sure. Luis is more convincing than you are. I don't know. Let's see. Maybe it was Michelle, yes? Was your card odd or even?
Odd.
Oh, you had to think about it for a second. You had to look up. Because the question didn't make sense, did it? Because you probably had a picture card like a jack, queen, or king, did you? Okay. Odd or even?
What is odd and what is even?
So like 1, 3, 5 would be odd, 2, 4, 6 would be even?
It's even.
Okay. This is way throwing me off. I don't know how this is going to work. Red or black? It's hard to remember when you lie.
Red, of course.
Okay. You notice the answer changed this time. Odd or even?
Who cares?
Even. Okay. We'll try. You're trying so hard. For example, Luisa, I might ask you, was your card a 5?
No.
It was not.
No.
It was not. She's like, I can't believe you even asked me. Why would you bother? It's not. So confident.
I was thinking about saying yes.
Okay. Think about it. If her card was a 5, she would have been stunned. She'd be like, well, oh my gosh, how'd you know? But it wasn't. I'm going to name all the numbers in a deck of cards. If you just face the audience, it's very likely you're going to give something away as we approach your number.
Okay.
All right, so just face the audience so they can watch your faces, because I'm wondering if any of y'all had an ace, a 2, a 3, 4, 5, 6, 7, 8, 9, 10, jack, queen, king. She definitely does not have a king. She definitely does not. Her card was a long time ago. People steel themselves so hard to focus. Once their number passes, they feel, finally I can relax. So it actually tells you something before that. Look, folks, this is more art than science, okay? But I'm gonna try. Oh my gosh, because I believe that somebody handed me your card if I believe you had the King of Diamonds. Yeah, the King of Diamonds. Thank you so much. Thank you, Michelle. You can have a seat. How about a giant hand for Michelle? And let's see, Will, I think, did you give your hand to me, your card to me, and return to see if you had the 10 of diamonds? Jeez. Yeah, woo! Okay. That was good. Luisa, could you hand me your card, and everybody's going to cheer when you show me that you have the 8 of diamonds? She doesn't. Oh, she's throwing me off. Here. Okay, there's clubs, hearts, spades, and diamonds, yes? Just name anyone.
Hearts.
I know you don't have a heart. Because she's still protecting that information. Yeah, right? She's protecting that information still. Name another one with that in mind.
Diamonds.
Can you show me the 8 of clubs? Thank you so much. How about a hand for Luisa? Truth or lie, fact or confabulation. Can you tell when someone or something is telling you the truth or lying in this day and age? Oh, I forgot the musical cue, but that's fine. If you'd like to understand more, just read all these articles. Everything will make perfect sense. Okay, look, I know what you're thinking. I don't have time to read all this, hundreds of pages, right? Couldn't someone or something just read all of this and digest it for me? That's why you come to a talk, right? You could have read all this stuff, but you having a person talk you through it is very helpful. So you can upload all these PDFs to a tool like Notebook LM. How many of you have tried something like this? Yeah? It's a great way to study and get a quick review of something at a high level. There's too many papers to read. You can't read all of them, so could you digest them some? So as some of you know, I'm just going to play just the last minute and a half of this because it generates a 25-minute conversation.
But this is like really powerful stuff. How do we even know it's safe? How do we test these AIs to make sure they're actually working?
Yeah, that's the big challenge, making sure these AIs are safe and effective. It takes huge data sets, tons of testing, everyone working together, the AI people, the doctors, the regulators. We got to be really careful before we start using this on real patients. It's got to be held to the highest standard.
Right, we're talking about people's lives here. No room for error. But it's more than just the tech itself, right? We need doctors who know how to use it and patients who understand what's happening with their data. It has to empower everyone, doctors and patients, not make things like less personal.
You're absolutely right. It's all about, that balance. Using AI to make us better, not replace us.
It seems like we're entering this new era of medicine where AI is everywhere, but, human judgment, empathy, that's still what matters.
That's it. It's an exciting time to be a doctor. We're on the edge of something that's going to, completely change healthcare.
I got to admit, after all this, I'm like both really excited and a bit overwhelmed. So many possibilities, so many challenges. But I think AI can make us better doctors and make things better for our patients.
I agree. And I think the most important thing is to, be open-minded, but also be cautious. And always remember to use this technology for good.
Yeah, it's about using AI to help people. That's it. This has been amazing. Thanks so much for, for sharing all this with us. I think we'll be talking about AI in medicine for like a long time. And I can't wait to see what happens.
I don't know. Do we still need lectures and seminars anymore? That works pretty darn well. Those people were not real. But can you tell the difference anymore? If you just heard that, I don't know that you could tell the difference. There's maybe subtle cues. It begs the question, so now is a question I've been struggling with, how to articulate, how to think about this. What makes a doctor, what makes a human? What makes a professional a professional? What makes a lawyer a lawyer? What do you need a lawyer for? All they do is talk to people and write documents, right? At least a doctor, occasionally I pull out a needle and a scalpel, right? What do you need an accountant for? You got TurboTax? When you pay your accountant, all they do is they have their own copy of TurboTax, basically. They just copy your data in there. What do you need a general contractor for? They don't hammer the nails into the wood. They just talk to people and fill out documents. What makes a professional a professional? I actually don't know the answer. I've been thinking myself really hard. I'm not sure anymore. Here's what I've come with so far, but I'd love to open up the discussion. What do you all think? Some people think maybe it's knowledge. I think you do need knowledge. But that's clearly not enough, because I spent a long time memorizing a lot of medical facts, and you guys think that's a silly parlor trick now. You're not even sure why that matters. So many people are like, well, it's empathy, kindness, being a friendly face. I find this an incredibly weak argument. A very nice nurse is very nice. A very nice actor could have a lot of empathy. A golden retriever has more empathy than half the doctors I know. Just take an AI talk box and strap it to a golden retriever, and that has more empathy. But I don't think that's what makes a doctor a professional. Maybe it's liability. Oh, well, the AI computer is going to do all this stuff, but we just have a human in the loop to accept liability if anything goes wrong. That's kind of a thing. Imagine a big tech company say, hey, guys, use our medical AI, and if anything goes bad, we have an insurance company. They'll pay you if anything bad happens to you, okay? Maybe better than the current status quo where they accept no responsibility for anything. That's assuming liability is still not the same as someone who takes responsibility and ownership for your situation, right? And will personally drive what you're looking for. Be your advocate. That's what you're hiring them for. So I'm thinking you do need knowledge. It's just not sufficient. It's necessary but not sufficient. And that really what it relates to is you need judgment. Right now, I think humans have better aspects of that at this point. This information is correct and that information is correct, and you can't look up what to do in the textbook. You have to reconcile those. You have to make a judgment. Is it more worth it to do this? What are your values and how do they relate to individuals, and what trade-offs you have to consider? Being nice to people is good. I think that does make you a better professional, but it's also more your ability to negotiate. I tell my trainees all the time, knowledge is a pretty basic thing, actually. The real skill in medicine is, can you make another person do what you want them to do? If you prescribe the medicine but they don't take it, what did it matter? If you want to go to the surgery but the surgeon won't go to the operating, what does it matter? If the insurance company won't pay for the procedure, what does it matter if you think you know everything? And again, more than just liability, do you take responsibility, professionalism for the situation where I am your advocate, I will take care of you, I'm going to personally figure out how to make this work, whatever it comes down to. You really need that more than a faceless insurance company who says they'll have liability. All right, I'll close out here. A couple quotes by Warner Slack, famously riffed off of Arthur C. Clarke. He said, any doctor who could be replaced by a computer should be replaced by a computer. Many people misinterpret this as advocating for replacement. This is saying the exact opposite. You cannot replace a good human with a computer, no matter how good the computer gets, because you provide a very different and unique value. And now with mountains of paperwork, patients on 6 to 9 month waiting lists, let alone billions of people worldwide who don't even have access to basic medical care, we should hope, you should dream, you should beg, please, let's get some AI in here. We need some help. In the meantime, some of my colleagues like Kurt Langlos would say, hey, AI is not going to replace anybody. But those who learn how to use it may very well replace those who do not. Yeah. So I'm very glad to be at a place like at Stanford, having the conversation we're having right here so that we can advance the frontiers, not just in terms of developing the technology, we certainly do that, but also in terms of how do we train retrain an entire generation of the workforce so that we can safely and effectively integrate intelligent systems into our processes, into our work to reach all of the patients who need us. Thank you all. Happy to take any questions or comments. There you go.
Thank you so much.
Oh, are we going to sit?
Yeah. We'll do like a little fireside chat. Just imagine it.
Intensive. Okay.
Well, thank you so much, Jonathan. That was certainly one of the most entertaining and, without question, the CPC talk with the most magic this decade. So I think
we'll up it next year, right?
Yeah, we'll bring you back. We'll bring you back. Since you're up for crazy things, I'm going to start with a little bit of a quiz for you.
Ooh, okay.
When you think
I need
about
my book. Wait, no. Okay, go ahead.
When you think of AI, what is the metaphor that comes to mind? I'd like you to complete this sentence. AI is like blank because blank.
Oh gosh. Well, what I used to say, AI is a marketing buzzword because it has no meaning. That's what I meant. But this is what I said, 5, 6 years ago when everything was like machine learning. Like machine learning's great, but it is way overhyped what it can and can't do. It's not going to complete anything. Now with these like language model generators, like holy crap. To me, I think the arrival, it is like the internet. It is that's the analogy I use. It's like the internet just got invented 2 years ago. And it doesn't mean that everybody got wiped out and all this died after the internet came, but it substantially changed the way everybody lives and does their work afterwards. And if you operate in a world as if the internet didn't existed, you are in big trouble. You're going to be left far behind.
Yeah. So for you, the metaphor that's closest is basically the internet. It's like another way of accessing the internet in a way.
Another way of communicating, interacting. Anything you do that involves written and or spoken words is not the same anymore, and you have to adapt to it.
Very cool. Some work, Angela Lee, who's here, and colleagues in computer science and at a company we work with called BetterUp have been looking at metaphors. Oh, do we need to replace that? Yeah. Working on the metaphors people think about AI, and they reflect sort of different mindsets. And yours is a very tool-based one, right? To you, it's a tool. Others think of more human or more anthropomorphic. Others think like gods and that. And so I think that's really fascinating that you, as a doctor, in this sort of like position you're in, think of it as a tool. And the other thing that ties with, to me, is this really key insight you said, which was, since it can do better without humans, we shouldn't have any humans anymore. And you said that's the wrong conclusion. We need to train humans to be better at working with these tools. Could you say more about that? Like, what does that mean to train somebody to be better at AI? What are some of the principles or ideas you've been thinking on for that?
There's a general mantra in clinical informatics, right? The technology is important, but it's like people, process, and technology. Nothing actually happens unless you have all of those. But that's a very generic answer. I try to challenge that particular scenario. I mean, it's a weird analogy. You guys watch the movie Hidden Figures? What is a computer? A computer used to be a person who would just like sit with a piece of paper and do calculations for you because it was kind of laborious. But you don't do that anymore, right? I mean, maybe you do a little bit. It's really evolved and changed. A lot of the jobs we used to have clearly need to evolve substantially, and you figure out how to. I may never write another letter of recommendation again in my life. And I don't feel that bad because I doubt anyone's going to read a letter of recommendation again in their life either. It's just kind of this weird evolution that we have of adapting to that change. Just like I don't physically go to the library anymore. Does anybody still do that? Okay, a few students do.
Our Uber nerds do, right? That's good.
But these are some of the changes that I imagine, just things that just won't make sense to do it that way. It doesn't mean like what you do doesn't have value anymore, but you have to rethink how and why you do them.
Great, yeah, fantastic. Let's open it up to the crowd. So we have one person in the back there.
Hi, can you hear me? Thanks so much. I just was interested if you are aware of any research about how patients might find the introduction of AI into clinical care, and if that's something you take into consideration about how acceptable they would find it.
It's the whole spectrum of, right, the adoption curve, right? You have your early adopters, your laggards, it's that whole spectrum. Some people are, yes, please, finally. There's like advocates for patients who said they should be empowered to have all their medical records and not depend on a doctor to interpret for them. And I think there's a lot of validity to that. but many who also have a lot of anxiety and fear. Wait a minute. I trust my doctor because I know him as a human being. I trust my nurse. She's literally laid her own hands on me that this is a real person who I can tell cares about me, not a cold, like heartless machine run by a tech company who doesn't care about anything. It's that whole span of spectrum, and we should expect that similarly, this waves of acceptability. But kind of like the internet, you can say, I'm holding out. I don't believe in this internet thing. Maybe you can hold out from social media, but like the internet, I don't think you could avoid it eventually in the modern world.
Great. We have an anonymous question from online, and this might be too soon for this, but are there any tests of medical practitioners taught by AI versus taught by a human?
Oh, that's interesting. So I recently took on a role, faculty director of medical education in artificial intelligence, because that role never existed before, by the way, before 2 months ago. But now our school of medicine realized we clearly need that because we don't know how to teach our students about this kind of stuff, and they need to know about it now. So we have some work going on right now. I was just looking at the results on our call earlier. This really weird study, right? Computer by itself does better than the doctor plus computer. In part, the fair critique was we didn't teach the doctors how to use it. We just said, here, look, here's this chatbot. Right. You want to use it? Go try it out. And most of them just didn't even know what to do with it. So we've done another study where instead we have a collaborative way. Before you use it, this is how you use it. And here's an example. And we haven't published this yet, but basically people do a lot better when you prime them.
So you give them like some instructions on how to work with the machine, and they do better. Has any of that been published yet?
This literally, we haven't written the manuscript yet. I just saw the results from our statistician this morning, basically.
Really fascinating. Yeah. Because I feel like that's a lot where we're at. Everybody's been focusing on the AI and the tech, and not on like how do you help people do it. I see my postdocs and PhD students, they're all using AI and talking amongst themselves about different techniques that are useful. But if you're not, say, in a lab here working on that, how are you learning what to do? So I think that's...
Most people don't have exposure. On the other hand, I think what was very powerful of ChatGPT, it actually wasn't the language model. The language model, GPT-3, actually existed a couple of years before it actually was released. The very powerful thing was the instruction tuning. It follows your instructions. And it was the interface. You don't need to be a data scientist. You don't need to be a programmer. You can just be a person who can talk, and then you can use this thing. And so now it was rapidly democratized. Millions and hundreds of millions of people are able to invent their own concepts. They don't have to wait for a bunch of ivory tower eggheads to tell them what to do. So I think that's actually very powerful in its way, scary in its own way too. And dissemination is, I think, a key part of a mission that a university can drive. And part of the reason I have this role is because there are medical schools across the nation who our students need to know about what this is and how to use it, but we don't have the expertise to know what to teach them. Right. They are looking to the Stanfords of the world to develop that curriculum, to find those things, to disseminate that.
Great. Any other last questions in the room? The back is very active today.
Yeah.
Yes, this is a very trendy and in need topic. I believe the innovation is really interdisciplinary. It's between AI and the doctors. Personally, I came from an AI world. I respect the doctor's domain knowledge so much because the data, like the model needs to include the fine-tuning domain knowledge and the RAG, the knowledge base. So my question is that I'd like your recommendation from an AI solution perspective. What's your recommendation or point of view that the AI solution will be easily adoptable, more welcomed from a doctor perspective, the other way around?
I mean, what's already happening now, but it was revolutionary 2 years ago, it's already boring now. It's paperwork. Hey, right, wouldn't you like if your doctor's visit was just like you and another human being having a conversation? Instead, where your doctors are frantically typing in the computer trying to feed this data-hungry machine. Hey, just talk to your patient, let the recording happen, and a computer will translate that in a note. That's been very rapidly adopted in just like 1 or 2 years. Most technology literally takes 10 years to make it in healthcare systems. We're very conservative, a lot of inertia, a lot of legacy to move. Here, they're adopted so fast because we're so desperate for that help. The other thing that's happening very fast is like, hey, help us find the right billing codes when we get more money out of the insurance company. I mean, whatever. That's a thing because it has a very strong business incentive. I don't think it's that exciting, but these are the things that are happening right now. Administrative use cases. The stuff I'm interested in, like the medical reasoning, actually getting patient care out there, it's very cool, but it's also scary, right? Because you mess up, you hurt people, and you often do it in very bad, nasty ways. I think having rigorous evaluations, getting people involved and stakeholders involved early on are all going to be essential. And stakeholders from the spectrum, from patient to nurse to doctor to a technologist and policy, all of that has to come together because it's all interfaces.
Those two examples really highlight that they're going to be useful when they solve a problem.
Yeah.
Right? And I feel like a lot of times they're like a solution looking for a problem. I just totally lost my train of thought. If only I had AI to remember things. What was it? It was a really good question. Well, okay, I'll switch to my second plan. As you look for the near future, one of the things you said was like you're always being asked to look 5 years in the future. The big talk right now is agents, right? It's all about agents. We haven't really seen a lot of evidence of agent success yet, but you seem to like this idea of agent. Do you see within medicine this idea of agents that have some autonomy to do things as a place where it will take off?
I think it will. It's clearly not good enough to use now. That's a good research project right now. Just like language models were a good research project 3-4 years ago, and now they're a practical tool. You can start to imagine how to apply them. In that benchmark paper we put out, it's in preprint right now, the current accuracy is like 60+% in performing a task correctly. Like you would not tolerate that in a medical environment, right? But that gives the engineers a benchmark to aim for, and I bet in 3 to 4 years they're going to get that up to over 90+%. And wouldn't it be cool if I don't have to tell my intern, okay, go check the patient's potassium, go replete it if it's needed, but also use this protocol. You can just say, computer, follow protocol X, go. I think that's actually not that far from the future. And also, if that's too scary, hey, computer, schedule an appointment with me with this patient within the next 2 weeks. That should be also a tractable thing.
Right. I remembered my thing, and I'll finish with it. So you said, I think it was a bit of a throwaway line too, that one of the most used searches for people is around health information. Could you say a little bit more about that? Like, so people are going on and saying, I have this thing on my nose. Can you, this is what's the diagnosis?
I think it is, even though there's this disclaimer, do not use this for medical advice, like, give me a break. That's the people are going to do it anyway. I was just talking to a venture capitalist who was saying apparently 20% of the content or the queries that a ChatGPT gets, it's all around people's health. That is the thing people want to know about, right? That's how you know, this is why I have an MD and a PhD. The PhD in computer science, I wanted to work on fun nerd problems, but MD because, like health problems is what people will often end up caring about. So how do we understand those domains and what people are hungry for? And the most important scarce resource in the healthcare system, it's not a medicine, it's not a hospital bed. You can manufacture stuff. You can't manufacture a person. You need an expert you can get for consultation advice. If you ask for an appointment for your primary care doctor right now, how long would it take you to get an appointment?
Long time.
Months, probably months, right? I just need someone to explain what this medicine is. I can't wait 3 months for that. So this is what they'll reach for.
Fantastic. Well, please, everybody, join me once again in thanking Jonathan. Thank you so much.
Thank you so much. Great to see you.
And join us next week, May 6th, when we have Katie DeSells, and we'll be talking about scale dichotomization. Exciting.